What conditions do I generally treat with prolotherapy? The number one condition that we see at Caring Medical in Oak Park is knee pain. The number one cause of knee pain that we see is knee degeneration, is a degenerated joint. Knee arthritis, that's the number one thing we see in the office here, and it responds great to prolotherapy, wonderful to prolotherapy. We keep a lot of people away from knee replacements or arthroscopies because they do great with prolotherapy. The most common knee conditions that we see in the office here is knee arthritis, chondromalacia patella, which is just cartilage deterioration beneath the kneecap. Some people call that patellofemoral joint syndrome or a tracking problem of the kneecap. We see a lot of meniscal tears as well as ligament tears, ligament injuries, knee joint subluxations, and pes anserina tendinitis bursitis, so a lot of knee problems. The number two condition or area that we see in the office here is low back pain. The most common cause of low back pain that I see for chronic low back pain isn't degenerated discs, though that responds great to prolotherapy. The most common condition that we see is sacroiliac problems, subluxations of the sacroiliac joint, sacroiliac ligament injuries. We see a lot of piriformis syndrome. We do see a lot of facet syndrome, spondylolisthesis, spondylosis, the various arthritic conditions of the back. Typically all respond great to prolotherapy. Probably the third most common area that we see is neck pain, chronic headaches. Most common reasons that we see, diagnosis that we see for that is myofascial pain syndrome. We see a lot of, again, spondylosis or arthritis, degeneration, the neck, a lot of subluxations or cervical instabilities. They respond great to prolotherapy. But just realize that any type of ligament injury, tendon injury, soft tissue injury, meaning that a person has a diffuse pain in a joint, the cartilage in the joint is very, very good, that it involves the other structures around the joint, those conditions typically respond excellent with prolotherapy.